Governor Doug Ducey is joining us here in the studio tonight. Governor, I want to first give credit where credit is due, because in just a couple days you have postponed evictions and utility shutoffs, deployed the National Guard, expanded Meals on Wheels and food stamps, launched child care for children of healthcare workers and first responders, and you got celebrity entrepreneurs to bring us 1 million masks. So with all of that said, in just a 1-week period, let's look ahead at where we go from here. Dr. Kara Christ yesterday said April we'd see our high point, and then cases in the hospital would peak sometime in May. May is 7 weeks away. Is it safe to say that we're going to be living in this strange world for months to come?
Well, what we want to do is make sure that we are prepared for whatever happens in our future. The public health challenge is what's top of mind right now. Thanks for pointing out all the things that we're bringing for economic relief for Arizonans who have been displaced by COVID-19. But we want to make sure that we're taking care of the people in the state. So the focus and framework really is on, first and foremost, making sure that we have the protective materials. That's the gloves and the gowns and the masks and the ventilators. We want to make sure that the people inside our hospitals are going to be able to be cured, that there's going to be hospital beds available for them. And then the folks on the front line, our doctors and nurses and emergency medical responders, have everything they need to deal with this crisis. Arizona's in a much different spot today than, say, what we're seeing in New York State. But we know that the numbers are increasing, so we want to escalate and make the proper decisions at the right time, that we protect and promote public health to the best of our ability, knowing that we're now dealing with this in our state.
Dr. Chris said we need 13,000 beds and another 1,500 ICU beds. Do those beds exist somewhere? And will you end up having to compete with other governors to try to bring them here? Everybody's going to need these beds.
Those beds do exist. So we will be able to handle the bed side of it. It is the medical personnel. If you have a bed and you don't have a doctor, that's not of much good use. So we're working on both fronts. The medical professionals, like I said, the doctors and the nurses, will be able to solve the bed issue. The bigger challenge right now, and Arizona is out ahead of this, are the masks and the gloves and the gowns. We're able to get out ahead of it because we're not facing the surge that a New York or a New Jersey is facing. The American manufacturing and supply chain is catching up, and we'll be purchasing the proper amount. And we're also accessing these from the private sector. You mentioned the Verstandig Foundation that donated 250,000 masks to Arizona just yesterday. We're going to need more, but we found that kind of cooperation and public-private partnership, and it's been a real win for our workers.
Governor, why not just lock the state down right now? I mean, it would be painful for a little while, but it might help in the long run.
Well, we're following CDC guidance, so all of my decisions have been guided by public health. I haven't been guessing, and I haven't been trying to outdo any other governor on announcements. I want to do things that are in alignment for our situation in Arizona in real time. To date, we've been one step ahead of this, each step along the way. So things are likely going to escalate. Right now, Arizonans are staying at home. I mean, I'm out and about because my day job requires it, but you can see it in our highways and our streets.
No rush hour.
And our schools are shut down. These types of things, and there will likely be additional things that we'll have to do. Our guidance is statewide, and like I said, it's in alignment with the Centers for Disease Control and Prevention, and it'll continue to be that way.
Is it a certain number of cases? What's the threshold? What would force a change?
Well, it's a combination of things. It's our level of risk, it's the level of spread, and then it's really the guidance of Dr. Kara Christ in alignment with our federal health officials.
President Trump said he would like to have ideally everything open by Easter. I think everybody would like that. Do you think he's offering false hope? Does that make your job more difficult?
Well, listen, I would love to see things reopen and get back to normal as soon as possible, as much as anybody. But we're not going to shutter anything that isn't in the interest of public health. And what the curve is out on the East Coast is going to be different than the curve that we face here in Arizona. So we're going to do things when it's safe to do it. We're going to focus on public health first, getting our citizens through this economic downturn. And part of it is I know Arizona is going to come out of this on the other side better and stronger and healthier. We want to make sure that we protect and save as many lives between now and then. So I think hope is a big part of this, but it's also the work and the facts that we have to deal with right now, today. And those facts are staring us in the face in Arizona, and we're going to address them with the best people in the state and in the country from a public health perspective.
Let's talk about schools. Schools currently closed through April 10th. I believe a lot of parents, students, teachers want to know, is it time to just cancel the rest of the school year? There's not a whole lot left to it.
Well, let's address that on April 10th. I want to say a special thanks to Superintendent of Public Instruction, Kathy Hoffman. She's been a real partner and a leader. All of us want to see our kids get an education. We want to see our kids back in school safely. This situation is, of course, doing more than complicating this. We've got a lot of heroes we're talking about out there, from the doctors and the nurses to the people that are stocking grocery store shelves. Well, so are our teachers who are working with our kids in these distance learning environment. There's been a lot of resourcefulness here. We've got this closed, not closed campaign that we're working on how kids are learning from home. And of course, the parents that are home with their kids in this situation, we want to make sure that we're clearly communicating. And as we have the facts on these decisions, Superintendent Hoffman and I will be making those announcements.
I want to go back to medical supplies real quick and talk about tests. You've expressed your frustration over the lack of tests. Banner told us today they had fewer people coming in for testing appointments because they had fewer test kits available today compared to what they had yesterday. Seems like that's not going in the right direction.
Well, it is going in the right direction. Today was not better than yesterday, but we've done over 6,600 tests. We need to do thousands more, but we've kind of been able to ramp up in Arizona so that we have a significant sample, and we want people that need a test to be able to access a test. This is all part of the manufacturing capabilities and the issues that are being faced in New York and New Jersey. So I'm confident that we can close that supply chain gap. We've got our private sector manufacturers that are on this as well, but it is a challenge, and it's something we're addressing every day.
Yeah, a lot of people would like to help out. Scientists at the University of Arizona said that they will have 7,000 test kits available by the end of this week. Do you know anything about that?
Oh,
will those be distributed statewide?
Yes, we were down in Tucson, and Dr. Bobby Robbins, who is a medical doctor and of course working with the medical school at the U of A, demonstrated some resourcefulness. They've done thousands of tests on their own. They've developed reagents that are FDA approved and medically will do the job. So yes, those are going to be available not only in southern Arizona where we have this issue, but we can use them all over the state.
I think the number that came out today was 30,000 Arizonans who applied for state health unemployment benefits in just the last week. It's an astounding number. I believe unemployment benefits in Arizona are among the lowest in the nation when it comes to checks per week. I think it's $240 you get every week. Is it time for that to change? Is that going to be going up?
What is happening in Washington, D.C., and what hopefully the House of Representatives will vote on tomorrow is going to allow us to provide a lifeline to Arizonans that have been displaced by this economic downturn. It will allow these dollars to be plussed up from an unemployment insurance standpoint. So let's wait until Congress acts. Of course, our state has been able to work in a bipartisan way to get a budget out, to do what we've done with schools, to make sure that we were able to let democracy go forward on Election Day and the presidential preference election. But if Congress can do what it's committed to do, we'll be able to provide clarity to Arizonans that need those dollars.
Arizona has quite a substantial rainy day fund these days. It's more than $1 billion. Seems like a rainy day to me. You're going to tap into that?
Oh, it's a rainy day. It's more than a rainy day. We're going to use every resource and every tool that we have to make certain that no Arizonan falls through the cracks, that we take our social safety net and we stretch it and we strengthen it, and that's what that rainy day fund is there for.
Governor, do you ever think, what if you were still running Cold Stone right now? What if you were a small business operator? I mean, what's your message to our local businesses? Like, talk to our friends next door at La Piñata, family-run business, struggling right now. What's your message to folks like that?
Well, that's what I was. I was a small business entrepreneur, and I know how this would have affected Cold Stone Creamery. I mean, it would have shut our restaurants down. So the advice that I've given to our United States senators, and I had a great conversation today with Martha McSally. She was taking me through the entire Senate package that will be voted on by the House tomorrow, and there will be a lifeline, whether it's a Cold Stone Creamery, La Piñata, or any of these small businesses. This is one thing that I think Congress is seeing, is that through these downturns, big business is often fine. It's the small and medium business, and it's the citizen that lives paycheck to paycheck. That's going to be our focus. That's where there's going to be some hope, and there's going to be some help in this economic relief package, and we'll have complete clarity on this as soon as Congress votes yes on it.
Okay, could be a couple days from now. Governor Ducey, thanks to you, and also thanks to Dr. Christ for talking to us every day. People are desperate for information about this crisis.
Thank you. Thank you for getting the facts out.
Yeah, we really appreciate it, and pass that along to your staff. I know everybody's working hard right now. Thank you.